My name is Malamba, and I'm actually coming from Malawi, currently residing in the district. And my original home district is Doha, where my mother is coming from. And I'm a citizen of Malawi. I did my primary, secondary, and indeed tertiary education in Malawi. I did my tertiary education with the Community Development Training College, and that was 1996. After graduation, I joined the civil service, working with our government under the minister. I worked for 5-6 years. Then I joined my Mana project in 2005. I worked also from 2005 up to 2013 when I Pachi. And with Pachi, I worked for 2 years. In 2018, that's when we set up Center for Research and Development Initiatives, the colleagues who work together in my Mana. And now, currently, I'm working as the programs manager with Center for Research and Development Initiatives. And in my role, I'm working as a facilitator in planning, implementation, and monitoring program activities at community level, as well as at district level, with some networking and partnerships internationally. I also work hand in hand with the project coordinators at community level, as well as the project officers. Then on the other hand, I also work with the executive director in organization management and administration. As I explained in my introduction, that I worked with the Malawi government. So my first employer was the Malawi government, and after working for 4 or 5 years, there were some unbearable conditions in the workplace. That's when I just made up my mind to leave the government and join non-government organizations. Fortunately, I got a job with my Mana project in 2005 as a facilitation and training officer. My role was much into mentorship and coaching the group facilitators on how effectively they should deliver the women group intervention using the PLA approach. I was also monitoring progress of the groups and help in conflict resolution, group management at group level. After 3 years, I was promoted to the senior facilitation and training officer to coordinate the women group intervention across the district. And this position gave me an opportunity to widen my knowledge and skills in implementing the healthy groups at community level. And not only at community level, I also had the chances to work with district teams, and they also work with some national team members. And adding on that, I was also able to participate in other international forums like workshops, conferences, which gave me an opportunity to have a deep understanding of health issues that surround maternal and child health. So I think, in short, my first encounter with the group was the time I worked with my Mana project. However, I had a background of knowing how community groups work, because my work in Malawi government, I also worked with the community groups, but focusing on other areas like business, the social groups. Being a group leader, I enjoy most the challenge accomplishing multiple tasks. Facing such challenges made me to develop my capacity of handling issues at community, district, and also at national level. Being a facilitator, I enjoy group meetings, more especially listening to the members. I'm someone who always don't talk much, but listen, because whatever people are coming up with, that adding on what I know gives me more courage and gives more ability to handle issues. As a facilitator, I enjoy most to learn and understand what people's views are, because experience has taught me also to learn that what I know can be maybe 25% of the knowledge and skills of what group members have. So learning and building from their experiences is what I enjoyed most. In 2009, we had a group in one of the zone areas, because our intervention was done, it was a randomized control trial. So we had to do it in zones. There was a lady who used to mock fellow women who were participating in the groups to say, you are just wasting your time, you are meeting, but you are gaining nothing. But then it was found that she was pregnant and her husband did not manage to source enough money for her transport to the health facility. When labor started, she was not able to walk by herself. And then the village also had no any means of transport except the group, which had a bicycle ambulance within the community. So the husband begged the group members to borrow their bicycle ambulance to carry her to the hospital. Despite her rudeness that the women were being mocked by her, they allowed him to use the bicycle ambulance. And as soon as he arrived at the hospital, she delivered a baby boy. And from that time, she became a prominent member of the group and then helped some women also in her village to join the group. So that scenario encouraged me most to say, someone who has negative attitude towards what you are doing, but if you show that you care, if you show that we are the same community, by end of everything, we'll achieve what we are supposed to achieve because we work as a team. My proudest achievement is the consultancy work I was offered to work with the World Health Session for the development of the community mobilization module. That was in 2004. And again, I was also called for another workshop where we were developing the reporting standards. So I'm very proud of this particular moment because to me, it was a big challenge considering my academic background, where I'm coming from. But I took it up and made it, it's not for Malawi, nor for Africa, but something for the global world. I am really proud and grateful to World Health, and more specifically to Professor Anthony Costello for trusting me that I can deliver among professionals, among doctors, talking, sharing what I know. So I'm really proud of that.